Should we do bedside rounds?
Splendid idea, and you're early too. Good thing I finished my bagel and coffee.
Okay, let me grab my notes, vitals, and the more.
The sooner I finish, the better. Then I can make my tea off time.
Maybe.
Good morning, Mr. Swordbraith. How are you again? This is the team rounds I told you about. This is Dr. McDreamy, and this is Florence.
Good morning, I'm Dr. McDreamy. I'll be supervising your total care here at the hospital. We're going to do some shop talk right now about your hospitalization, and just to get up to speed and make sure we're all on the same page. If you have anything you want to add, that might help us to figure out what's going on, feel free to jump in as we talk about this.
Okay, sounds good.
Mr. Swordbraith is a 58-year-old gentleman who presented with 3 days of shortness of breath and leg swelling. Our working diagnosis is congestive heart failure, and we've been diuresing him for 2 days. Florence, have there been any overnight events?
Yes, from my report from last night, Mr. Swordbraith has been having more difficulty breathing. He's got his laces late last night, and he put out 150 ml of urine. The night nurse also told me he was having a hard time trying to breathe and a hard time trying to sleep, so we had to elevate the bed for his comfort. This morning his blood pressure is 110/50 with a heart rate of 112. His respiratory rate is 24, which is up from yesterday, which was 18. And now he's on 4 liters O2. His saturations are 94%, which is slightly lower than yesterday. On my examination with him this morning, I noticed some crackles on examination. He's able to get up and go to the bathroom, and he's pretty steady on his feet. I have concern that he might be getting worse. His weight today is 84 kg.
And that's 1 more kilogram than his admitted weight. I agree with Florence. This morning when I saw Mr. Swordbraith, he told me he slept with the head of his bed elevated, indicating increased orthopnea. He denied any chest pain or palpitations. On exam, his neck veins show some JVD. His heart had regular sounds with an S3. His lungs had bilateral rails up about 1/3. On telemetry, his pulse ranged from 70 to 110, and sinus labs showed a stable hemoglobin. His creatinine is at baseline with normal potassium. I think his CHF is not being treated aggressively enough, and would recommend we try to diurese more. I have ordered a chest x-ray to confirm the pulmonary edema, and am awaiting the results of his echo. In the meantime, I would like to increase his Lasix dose and monitor his urine output very closely.
Does that make all sense to you, Mr. Swordbraith?
Clear as mud.
Well, basically what's happening is your heart's not functioning well, and when the heart doesn't function well, fluid accumulates in your lungs and causes the shortness of breath you're experiencing. When the heart is not functioning well, fluid can also accumulate in the legs and cause the swelling you were also noticing this past week.
So why am I not breathing better yet?
Right now we're trying to fine-tune your medications, so we're going to increase that medication you're getting called Lasix. That Lasix will start pulling fluid out of your lungs, and when that starts happening, you should start breathing easier.
When do I get to go home?
We will be comfortable discharging you home after we pull off more fluid from you and you're breathing better without oxygen. Hopefully we can decrease your weight by 5 kilograms, so we expect that you'll be staying with us for another 2 to 3 days possibly.
Do you have any other questions, sir?
Well, you know my phone doesn't work.
I'm sorry to hear that. Nurse Florence, can you check with Scotty in engineering to see if you can get on that and maybe fix that for him?
Not a problem. Will do.
Thank you.
Well, Mr. Swordbraith, do you understand the plan for today? Is there anyone else you'd like to talk to about your condition?
I think I get it. You're going to give me more Lasix to pee more, and then I'm going to breathe better. And that sounds good. If you could just call my wife, let her know what's happening.
No problem.
Very good. Is there anything else? Florence, is there anything else you need?
No, thank you, doctors.
No, thank you, Florence.
Man, I gotta pee.